Hello everyone, my name is Angelica and today I'm going to be talking about an osteopathy treatment, and in particular we're going to focus on the organs, so a visceral treatment. I have with me here Joey, and he's just going to tell us a little bit of what's been going on the last couple days before we get started. So what's happening?
So I've been constipated for the last 2 days. I haven't been able to go, or just very little bit, and for the last 4 days or so I noticed a difference in my bowel movements.
Okay, so just to clarify, he's basically having constipation, and what we're going to work on in osteopathy, when I hear that, I want to go to the gut, I want to check out what's happening here. So I'm going to check his small intestine, I'm going to check his large intestine as well, and also the segments that relate to that level, so like L4, L5. So first off, I'm just going to ask Joey to lift the shirt up so that I can access the abdomen. Make sure my hands are warm. And one thing we want to do is just check the temperature of the belly. So if there is any stagnation, for example, or congestion of fluid, one area may be colder than the other. So that's what I'm going to do. And I'm feeling like there is pretty much even heat through the abdomen, except just below the belly button. So now what I'm going to do is I'm going to start by checking his colon. So we're on his ascending colon, and I'm just going to check for what we call the motility and the mobility. So first thing I'm doing, I'm checking mobility. I'm just seeing if the colon is moving in all the different directions, and wherever I feel that it's restricted, I just hold there. And I can also get assistance with his breathing, so I can ask Joey, take a breath in and out. And respiration also helps. And again, deep breath in and let it go. And then there I felt a release. So again, I'm reassessing. That's one thing in osteopathy that you'll notice is the person does an assessment, then they'll do a treatment, and then again they'll do a reassessment. So all the time there is interaction between what's going on underneath the practitioner's hands and the patient's body. Now, we've just done the ascending colon. I'm going to go to his transverse colon. Same thing. We're just going to start off by checking the mobility. So I'll translate to both sides. I'll check for restriction. And once I feel it, I just hold and I wait for a release. Again, can you take a deep breath in? Breathe out and let it go. So the tissue tension decreases as I hold. And again, breathe in, breathe out. And with the respiration of the patient as he breathes out, it also helps with releasing the tissue tension. Again, what do? I recheck, make sure things are not restricted, moving nicely, there is ease of motion. Then I can go on to the descending colon, and usually I do this from the other side, but just so I don't block the camera, I'm going to do it from this side. And again, the same thing. And if it's very painful when I go what we call into the barrier, so treating the colon directly or taking it into a position of restriction, if it's too tender for the patient, I can always go indirect, wait for the release, wait for the body to release. I can have them breathe in and out a couple times. And once that feels better, I can then go into the barrier directly and treat for the restriction. And then once that lets go, we've just done his colon, I'll go on to the small intestine and I'll check how the small intestine is doing. So we call it sensorial listening. I'm going to have him take a deep breath in and out. And at the same time, now what I'm checking for is motility. So the small intestine, as he breathes in and out, is moving. So with respiration, it's augmented the movement. I can also just sink in and bring my intention to the small intestine and just feel the motility myself. So we have restriction here. So how do we treat this? I'm going to have Joey bend both his knees. And as he bends his knees, he's slowly going to try to bring both his knees to the right side. Nice and slow. And hold. So that's it. He just holds, and I hold until I feel a release. And then once that lets go, I have him bring his knees over to the side a little more. And stop there and hold. And can you move your right arm onto your chest there? Thanks. And then go all the way to the side if you can. And there we have a nice release. So I'm going to have him bring his knees back to the center. Take a couple breaths in and out. And I'm just following that. Following the motion of the small intestine. Now we're going to go the other way. So I'm going to have him bring his knees to the left, nice and slow. And stop there. So this kind of treatment can be done for infants as well and kids. I've seen a lot of kids who, for example, have colic or have problems with digestion. It could be that they're constipated, it could be that they have bloating, it could be that they have gas, diarrhea, not absorbing the food as well. People with IBS, this is good for them. Any abnormal patterns in digestion, I would go here and I would check the small intestine and the large intestine. And bring your knees over a little bit more. Good, and hold. So even you may not be able to see this, but my other hand is on his lower back. So I'm monitoring there what's happening with his lower back as well. And just with my hand under his back, it causes what we call inhibition of the nervous system. In particular, his sympathetic nervous system. So that means the part of the nervous system that fires, giving too much stimulation to the colon or the small intestine. So with my hand just being placed there, it's inhibiting or relaxing that part of the nervous system that goes to his gut. Okay, and go as far as you can with your legs. How long do I do this for? I do it as long as the body needs it. So at the same time, this whole time, I'm listening to what his body is doing in response to the treatment. I'm just feeling tissue texture under my hands. I may feel heat. It's an indication I have a release. I may feel less tissue tension, and then come back to the center. And then 3 deep breaths in and out, and we just do the breathing to reintegrate the small intestines. And a lot of people also have a lot of tension in the abdomen or belly where the solar plexus is. So what I would do there is I'd go onto that solar plexus, and then I would release the tension through there as well. Dr. Still said that there's brains of the abdomen right where the solar plexus is, or there's a bundle of nerves in the belly. So it's very important to treat that and to just calm it down so the whole digestive system calms down. Especially when you're talking about constipation, because with constipation, it's an overactivity, overstimulation to the digestive system. Okay, good. Now the thing I would do after this is also treat the segments related to the colon and the small intestine.